Here's a presentation on Chapter 11, Ruminant and Swine Anesthesia. Start off with ruminants and temperament and economics. Ruminants don't undergo general anesthesia as often as horses and small animals for a lot of reasons. They don't require general anesthesia usually because of their calm nature and the ability that we have excellent restraint methods with these guys. Many surgeries are performed using local or regional anesthetic techniques and physical restraint, which, for example, in the case of a cow, would be a squeeze chute or some other form of keeping them from being rambunctious. It's always important whenever you're doing anesthesia and administering anesthetics to consider drug withdrawal times in food and milk producing animals. That is law, and you need to pay attention to that. And general anesthesia in production animals is not often economical. Farmers just don't want to spend $20,000 to operate on a $500 cow. Again, because of their size, special equipment is going to be necessary, such as squeeze chutes, tilt tables, head gates, hoists, transporters. All are things that we can use to make up for our lack of strength and their predominance in size. Small animal equipment can be used for small ruminants such as lambs and kids, even some smaller goats and smaller sheep, and that works just fine. If you remember any of your anatomy and physiology for ruminants, you'll remember they produce a lot of saliva, which can be easily aspirated during anesthesia. It causes a lot of problems, and ruminants are prone to regurgitation and bloat during general anesthesia. They present some unique gastrointestinal challenges. Patient preparation is going to be good patient preparation. It's going to be good patient preparation. Use the same basic principles as you would with small animals. You need to assess their conditions and all the mitigating factors. Prepare, weigh the animal. That can be done any one of several different ways. Make sure the patient is fasted to prevent bloat if at all possible. Prepare equipment for and place an intravenous catheter in these guys. Calculate the volume of each agent to give, including any fluid administration rates that are going to be going on. Review your oxygen flow rates and make sure you have those calculated out and are ready for that. And again, prepare equipment required to administer drugs and fluids, equipment for endotracheal intubation if we're going to be intubating, and any monitoring equipment that we're going to be using. Assemble, test the anesthetic machine, ventilator, make sure everything's up, it's working. Don't take anything for granted on these guys. Selecting an anesthetic protocol, an anesthetic plan, factors to consider. Number one, even with ruminants and swine and camelids, we're going to have a minimum patient database. We will assess them and give them a physical status class 1, class 2, class 3. And then we also have to look at the type and the duration of the procedure that we're going to be doing. And when we take all those into account, we should be able to come up with a good anesthetic plan for that patient. Equipment preparation, make sure all your equipment is present before induction begins. Again, with large animals particularly, we don't have time to run around and look for whatever it is we forgot to bring in there to begin with. So check and double check. And we probably are going to use, if we're going to use an anesthetic machine, we'll be using a circle system and a ventilator, especially in larger bovines and that kind of stuff, because they just do not breathe well on their own. Make warming equipment available for small ruminants, calves, for calves, kids, lambs, all piglets, anything we're doing, make sure that's there, because like in any species, small ones like to get hypothermic. And have a crash cart for emergency drugs and equipment. Make sure you know where the stuff that you need will be if things go bad. For pre-medication or sedation, tranquilizers are generally not needed prior to IV catheterization, induction in calm and tractable animals. Of the ones we mess with, probably in many ways, these guys are the easiest to handle. because we have usually the best equipment to handle them with, but most of them, with a little bit of reasonable restraint, you can get IV catheters in without any problem. If you do have some aggressive, excited, stressed animals, some of these guys get pretty rambunctious, then we may need to go ahead and tranquilize them. But no, most of them do pretty well. Anticholinergics cause saliva to become thick and ropey. That is a predominance of sympathetic signs. If you block the parasympathetic secretions, all you have left are sympathetic secretions, and the sympathetic secretions are thick, ropey. The term I always like to use is they're kind of boogery. They're just kind of nasty, and you really don't want those. You want, actually, the saliva is a good thing because it dilutes out the really thick and yucky secretions. IV induction, there's all kinds of ways to do this. Some people do it in a special padded area, in a transporter, on a tilt table, in a squeeze chute. If you're going to do general anesthesia, you want to get them to unconsciousness rapidly with minimal injury to certainly to the patient and to the people involved. And you want to get immediate control of the airway because they do like to either bloat or especially regurgitate. You really want to protect them from aspiration. There's all kinds of things we can use on these guys. Double drip is very popular. You can use ketamine and guaifenesin IV to effect, and then maintain on that. Double drip is a good combination for cattle for some procedures. Larger ruminants, you may need IV agent bolus. Smaller or compromised ruminants, you give an IV agent to effect. And for I hate to say this, lambs, kids, even calves, you can use propofol. It's gotten cheap enough now that if you have an animal that's really either a pet where the economic value is irrelevant, or if it's a very valuable animal, then if you're going to use an IV agent, propofol is excellent for small ruminants. And you can mask these guys down too. Position, if at all possible, try to get them into sternal recumbency for intubation. It really does work a whole lot better. It's kind of like dogs. If you can get them sternal, it's a whole lot easier to intubate than rather say horses where they're done lateral. Watch for, again, regurgitation to prevent aspiration. Try to get that tube in as quick as you can and go ahead and inflate it. And that way, if fluid does come pouring back out the esophagus, it's not going to go down to the lungs. Check for vital signs, intubate as quickly as you can, make sure you have a live patient, and treat accordingly. Endotracheal intubation equipment, we do intubate these guys, especially for long-term procedures. We try not to, in many ways, just use heavy sedation, but if we're using general anesthesia, you need to intubate them. We need appropriately sized endotracheal tubes in most cases, depending on the size of the patient. Either a 22, 26, or 30 millimeter tube will work fine. In small ruminants and calves, you can use a stylet to help pass endotracheal tube. In adult cattle, you can use a mouth guard or gag or speculum to hold the jaws apart. In small ruminants, calves, a laryngeoscope is helpful. It really does good. I usually on these guys often do those blind. I use my finger and hand to push the soft palate up, the epiglottis down. I can put my finger basically through the openings to the glottis and then slide the tube along that, and that works fine. Or you can use laryngoscopes, you can use stylets, whatever works. You want to make sure that you have a syringe to inflate the cuff. And usually that's going to take a 10 ml syringe for small calves and small ruminants, and about a 60 ml for adult cattle. You may need a long forceps to help control, and suction in case they do aspirate or they have a predominance of a lot of that yucky saliva they like to produce. They get real slobbery, kind of slickery. For intubation of small ruminants and calves, they have a fairly small oral opening, and thick caudal tongue make visualization of the larynx somewhat challenging. They're a little bit like trying to intubate langomorphs. The use of a stylet protruding beyond the end of the tube results in better visualization of the larynx. You can use that as a guide. Slip it between the vocal folds and the glottis, and then pass the tube along through that. The head should be extended, tongue gently pulled forward. The laryngoscope is placed to visualize the larynx. Pass the stylet into the airway and then pass the endotracheal tube over the stylet into the larynx, down into the trachea, and then you inflate the cuff. Okay. If you're used to doing small animals, particularly dogs, this is not that much different a system. It's a little harder to see. They have a thicker tongue, but once you get used to putting them in the proper position and using the right technique, intubating calves and small ruminants is not that big a deal. Here's a picture showing intubation of a calf. They have a laryngoscope in place. In this case, you put their fingers in the nostrils, to grasp. I've seen people just pull up on the lips as they would a small dog or cat. That's not a problem. In the second picture, you can see there's a tube, there's a stylet. The stylet is then placed down past the vocal folds, and then the tube is slipped over it. The stylet is pulled, and the calf is intubated. Intubation of adult cattle. This is done fairly blindly just because of the size and thickness of the oral and the pharyngeal structures. A mouth gag is placed and head is extended by an assistant. The anesthetist protects the endotracheal tube cuff with the non-dominant hand. In my case, that's the left hand. And using the non-dominant hand, that's a left hand if you're me, the anesthetist palpates the larynx with the fingers and directs the endotracheal tube into the larynx while advancing the tube with the dominant, that's right-handed because I'm right-handed, pass that into the pharyngeal opening. As a side light, one time I did have to help with an anesthetic procedure at the Dallas Zoo, and I got the joy of intubating a sable antelope that had bilateral fractures of the lower mandible. And this, and it was the same process, left hand in, push the tongue down, up the glottis, feel the laryngeal opening, slide the tube in. But unfortunately, they did not have the sable antelope down very far. And as I was passing the tube, he was kind of chewing. And the problem with that was there were these sharp bone fragments that he was chewing that were kind of macerating my non-dominant arm and hand. And that got to be really a very unpleasant experience. But we got him intubated and he did fine. Turned out to be the meanest little son of a gun you ever saw. Whew, boy, he was not happy. Inflate the cuff, remove the mouth gag, and you've got him intubated. It's done blindly. Use your non-dominant hand to find the structures. Pass the tube using your right hand right along there. Get it through the vocal folds. Piece of cake. And there you show, cow's that's a pretty good sized cow. Got their mouth gag open, big thick tongue, pull it out of the way, and you're going to slide the hand down and get it done. Maintenance of anesthetic with inhalants. Small ruminants and calves, it's almost identical to small animals. In this case, a calf, lamb, kid, really is kind of about dog-sized thing, and you can use SIVO, ISO, whatever makes you happy. Adult cattle are much more similar to horses, and ruminants particularly tend to hypoventilate. So if at all possible, you either need to put them on a ventilator or find a way to provide some sort of positive pressure ventilation for them. Even if you're squeezing on the chest with your legs or knees or something, try to keep them ventilated because they really do just kind of like to not move their chest at all. Maintenance of intravenous anesthesia is reserved for short, about 20-minute procedures in healthy patients. I've seen people take that out to 30. Okay, somewhere in the 20-30 range is about maximum, and can also be used to extend anesthesia in intubated patients. Sometimes I've seen people use a little double drip in combination with a lower flow of ISO or SIVO or whatever, and there's all kinds of combinations you can use, but double drip is what's commonly used. Patient positioning, comfort, and safety use the same principles for small animals. There are some additional concerns, certainly with ruminants. Position ruminants with the mouth lower than the pharynx, so all the salivars, and if there's any regurgitation runs out, you don't want it pooling in the mouth. and provide padding to prevent neuropathies and myopathies as in horses. There's a lot of weight on these guys, and yes, you don't run as much risk probably of facial nerve paralysis, but radial nerve paralysis can be a real problem with these guys. So make sure they're padded, even if you're going to be down 5 minutes. In 5 minutes, you can do a lot of damage. So make sure they're well padded, particularly over the radial nerve. And a good picture of this cow on a nice polled Hereford on a tilt table, strapped down. They have the leg on the far right wrapped and then chained down. Don't ever underestimate the strength of a cow. They can produce a lot of strength and a lot of force, and so we tend to probably overly restrain in some cases because we just don't want them getting loose in a mess. I mean, it would be a disaster. So, you know. And recovery with ruminants from anesthesia. Ruminants really have some pretty smooth recoveries. Your book's not kidding. They generally just kind of take it real well. They're just kind of laid back about it. You know, it's like, okay, well, it's all right. I'll be fine. You know, go eat some grass in a little bit. And the patient is usually transferred to a padded recovery stall, placed in sternal. Again, make sure the mouth is lower than the pharynx so they don't aspirate or don't breathe in their slobbers or whatever. Watch for any bloating. They will build a lot of times a little gas, and then as they start to recover, then they start to belch real good, and they'll take care of it. If they don't, then we may need to address that. Keep the cuff inflated or partially inflated to prevent aspiration for as long as possible. Extubate when there's a strong swallowing movement or coughing appear, or if it's a really bad cow with a bad attitude, when you think it's safe. And then run like heck. Remove more air from the cuff if extubation is difficult. Okay, we're really going to kind of clean it out. Leave unattended after patient is lying in sternal recumbency without support, and don't need to withhold food or water. Okay, they can go back and eat and do fine. In fact, a lot of times if you try to withhold food or water from these guys, that's when you end up with bloating and some problems. When you want to get that bacterial and the whole gastrointestinal system moving along again, they need to be belching from the front and pooping out the back. Showing a cow, fairly large, gender unknown, kind of looks like a bull from the head, laying there, he's got his halter on, he's got his IV catheter. Notice that he has an IV jugular catheter. He's got his little tongue hanging out, it's got the tube hanging out, and he's just laying there kind of chilling. You know, he don't care. All's cool. Life is good. He's going to go back. He's going to have some more grass or hay. Sternal recumbency, once the danger is past, requires a little monitoring. That bull in the last one does real well. Ruminants tend to lie very quietly, and they won't stand until stimulated. Well, I mean, eventually they will, but they'll lay there for a long time. It's not necessary to then withhold food or water unless indicated for some medical reason or whatever. If we did something gastrointestinal, that might change our perspective on it. Camelids, I will admit to you right off the top of my head, I don't have much experience with camelids. What I've had is either by observation or through anecdotal stories or whatever. Camelids are not particularly popular in my part of the world. In a lot of part of the United States and other places they are. And you'll see a lot more of them there. Around here, we just don't have them. So we just don't have exposure to them. Llamas and alpacas require anesthesia similar to that of small ruminants. They are not true ruminants. The first stomach plays a role similar to the rumen, but they're technically not true ruminants, even though they kind of act like ruminants. They have copious saliva production, hence they love to spit, and they are prone to developing nasal congestion when in lateral or dorsal recumbency. And that's something you really probably ought to remember. They are prone to developing nasal congestion when in lateral or dorsal recumbency. They are obligate nasal breathers and can develop upper airway obstructions during anesthesia. They don't breathe through their mouth, or any breathing through the mouth is so small as to be inconsequential, And so if they can only breathe through their nose gets really, really congested, you can end up in big problems. Preparation for anesthesia is the same for any small ruminants. IV catheters are placed usually in the jugular or cephalic veins. They'll work either way. Thick and tighter neck skin makes IV placement challenging. They can be a challenge to try to get an IV in place. If a hematoma forms due to unsuccessful venipuncture, postponement of a non-emergency procedure may be advisable. Okay, so try to avoid the hematomas. For anesthesia, it's about the same for small ruminants. Okay, they're bigger, but they act like small ruminants. Aggressive camelids may be resentful of restraints, and they let you know that very quickly. They do not take well to restraint in some cases. Some of them are fine. Others get a little testy about it. Ventilation is usually easier to maintain. Some may require mechanical ventilation in the larger llamas and that kind of stuff. That certainly is something you need to keep in mind. Heart rate is certainly more variable than with ruminants. Ruminants tend to have a slow but a pretty good heart rate. If we have a real bradycardia with some of these camelids, then we may want to use glyco or atropine. I like glyco, personal preference, but certainly either one would do the job. Patient positioning. You really need to take care with a long, flexible neck in positioning and recovery to prevent injury. You can cause some pretty serious damage to that neck if you just let it flop around, or you don't support it, or it falls off the end of the table, or they hit the head, or it flies around. Make sure you support that long, flexible neck. In their normal state, they take good care of it, but under anesthesia and relaxed, it can be a problem. They have large and prominent eyes. Again, we want to protect those. A lot of people will put little bandages or even wrap them. I've seen people use towels with elasticon or vet wrap or something around it to protect their eyes. And again, position the head to drain saliva, regurgitus. They, again, are copious saliva producers. We don't want them running back down into the trachea and the lungs. Sternal recumbency is usually recommended. The head and neck should be held upright. For labored breathing, or if in stridor, if it's evident, oxygen can be delivered via a face mask. As a general rule, for most of these guys, we're not providing, unless they're intubated, providing supplemental oxygenation. They usually respire pretty well. However, if we do end up with some hypoxia in these guys, and this would be a good time to have your capnograph, or better yet, a pulse oximeter on there. You can measure their SATs. You know, if your SAT starts to drop, and it starts to drop either precipitously or below whatever you feel is a comfortable level. For me, that's about 90%. Then we're going to start to treat them with some supplemental oxygen. You can use nasal tubes, which work really good. If obstruction is not alleviated, the attending veterinarian should be notified immediately, and then we may have to take some rather extreme measures. Usually that doesn't happen, but we need to be cognizant of it. And there's several different ways to supply oxygen to these guys. And there shows a camelid in recovery, nice shaved neck, you know, for the catheter. Got tube in place, tied in, kind of like we would a dog, gradually starting to wake up, doing okay, watching the, you know, make sure we're, you know, supporting that neck. Fortunately, most of them are pretty hairy, so you can get a good handful of hair. And there's another one. You know, this one has bilateral nasal tubes, which is a good way to provide anesthesia if we're doing gas anesthesia, or if we want to, particularly to make sure they recover and they have good oxygenation. That's a good thing to do. That one looks like he's really goofy, don't he? Swine. When we go into swine anesthesia, we step into a little bit different world. And in many ways, philosophically speaking, when we do swine anesthesia, it's as much like human anesthesia in a few cases as it is more like veterinary anesthesia. and they have some unique features we'll talk about in a sec. They are challenging to restrain. Pigs can get pretty testy. Sedate and anesthetize due to unique species characteristics. Pigs don't take prisoners. Okay, let's just be honest with you. Little pigs not a big problem, but big pigs got attitude. We are, of course, going to do physical examination. We'll probably have to sedate. We can use IV catheterization. But almost everything we do is more difficult with them than with other species. They just don't cooperate. They just don't like being messed with. Physical exam of swine, you want to do a general observation, assess the respiratory rate, character, observe obvious problems. Are they limping? Do they have a broken leg? Are their guts hanging out? That kind of stuff. Swine are difficult to restrain. For a more involved physical exam, we can get them kind of corralled and stuff, but they tend to fight it and it makes it very difficult. Really with pigs, we want more of a patient history to determine their health status. Long histories on pigs are common with short physical exams. Assessing the cardiovascular status and drawing blood samples are difficult to impossible, because about the only place you can get blood from a pig is the anterior vena cava, and that way you have to lay them on their back, and you have to take a very long needle, go through the thoracic inlet into essentially the chest, and find blindly the anterior vena cava and draw blood. Now sometimes you can get a little bit of blood from ear veins in these guys and that kind of stuff, but for any significant volume of blood, you're having to go in and do anterior vena cava sticks. If you're a practiced swine person, that does not prove to be that difficult, but unless you've had a lot of experience, it is a tough thing to do. So, pigs are kind of a little bit of a crapshoot when it comes to anesthesia. Pre-medication or sedation is usually indicated. If we do that, we're going to do it IM because we don't have veins. There are certainly no readily available peripheral veins. They have very thick layers of subcutaneous fat. And so to get into muscle, we're going to have to use 1.5 to 2-inch muscles. So you really got to get in there. We're usually going to inject the neck muscles of the neck, caudal to the ear, and 3 to 5 centimeters lateral to the dorsal midline. So we're going to be going up there. We're going to stay away from rear legs or backs. We're going for the neck. Swine are somewhat resistant to sedative drugs, and so we have to use a combination of a tranquilizer or sedative, an opioid, and a dissociative all together. Yes, swine anesthesia is an interesting business. May produce sedation enough for short surgical or non-surgical procedures. TKX is one of the more common combinations. T is for tilazol, K is for ketamine, X is for xylazine. I've used a lot of TKX in pigs when somebody has put a gun to my head and forced me to do something with pigs, and it does work rather well. TKX will induce anesthesia, particularly for, say, like a swine castration or something like that. Eyes are not suitable for information regarding depth of anesthesia. Just forget about that. Relaxation of the mouth muscles, so the mouth can be open without resistance. That is, the amount of resistance in the oral muscles or the masseter muscles is your best indicator. If the patient isn't deep enough, more anesthetic must be administered, and pigs are real good about letting you know if they're not deep enough, okay? They will let you know. An IV catheter in their ear vein and administration IV induction drugs in small increments. You can use an ear vein, but it's going to be small, and they like to come out, and they like to blow, and they like to form hematomas. Administer inhalant anesthetic via face mask. That usually works pretty darn good. And there's a pig sedated with TKX, and you're looking at it feeling, well, how do you know that's just not dead? What if he's sleeping? It's kind of a silly picture. I like the caption. The pig became laterally recumbent 15 minutes after IM injection of TKX. The blood on the side of the neck marks the site of the IM injection. So that's a pretty good idea. Below the ear and back a little bit. Good neck muscle there. That's probably the best thing about that picture is the blood spot. And then here's a ear vein in a pig. If you do a lot of swine practice, you'll probably get used to doing these. And if you want to look at the picture in your book, you can follow along. Use of a face mask in a pig. I guess when I think about pigs, I generally think about swine raised commercially. We do see, some Vietnamese pot-bellied pigs in practice as pets. They work fine. There you go. Swine intubation is challenging because of poor visualization. They have a very small mouth opening. They have a very narrow dental arcade. Anatomy of the larynx, they have a large laryngeal diverticulum. They have a fairly proximal trachea. The laryngeotracheal junction is at an angle, and they love to form laryngospasm. This is one where they tend to resemble humans as their propensity towards laryngospasms. To get them intubated, you place them in sternal or dorsal recumbency. I tend to like sternal. Place using a straight stylet and a laryngoscope, or you can use a curved stylet. Whatever you're used to using, you're probably going to need, at least with pigs, I think, a laryngoscope. I don't like laryngoscopes, but in pigs, I'm pretty sure they're pretty much necessary. And they show you pulling using straps to pull the top jaw back, pull the tongue out. The picture on the right shows using a laryngoscope to get back there, and if you can, especially with that straight laryngoscope, get back, push the soft palate up, push the epiglottis down, and then take the blades, and sometimes you may have to rotate it laterally and then go up and down, and then put it in, and then they're using a tube with a stylet. Sometimes the tubes are too flexible and just don't want to go through the vocal folds. Having that stylet in place will make all the difference in the world. Stylet goes through, tube goes in, stylet comes out, laryngoscope comes out. Happy pig, breathing gas. Use small animal static machine and circle systems in all but the very biggest of pigs, and then if you have to, then you can move on to the large animal machine on very large pigs. That may be good because very large pigs can have problems with ventilation, and you need to use your ventilator. Monitoring, you can palpate the pulse in the ear or inside of the carpus. Brachial artery is very easily palpated in small pigs. You can use a Doppler on the tail artery. Pulse oximeter you can use on the tongue or snout or ears of pink pigs. If you have a nice pink pig, pulse oximeters work really well. You can use respiratory monitoring with a breathing bag and capnograph. Capnographs work great on pigs. If you got them intubated, capnographs work great. It's showing you Dopplers, and a blood pressure cuff. So, they're a lot like putting them on people. If you're using these things, that's why very often pigs are so much more like people than they are like the animals you're used to. And showing pulse oximeter, you can put it on the tongue. I prefer the tongue. You can also put it in the nasal orifice. You can put it in where they breathe out of, the nasal orifice. One thing we always bring up, and it's really important because, again, it's something that's common to pigs and to humans, is malignant hyperthermia, or just referred to most commonly as MH. Most commonly is going to be associated with inhalant anesthesia. The other class of drugs that will cause or predispose towards MH are going to be the muscle relaxants. We don't use muscle relaxants in pigs, so if we're going to end up with MH, we're going to end up because of using some sort of inhalant. Mutation in one gene that controls calcium metabolism in muscles, what sets it off. You'll see they go into muscle rigidity. There will then be a huge and rapid rise in body temperature. They become hypercapnic and hyperkalemic, and they can progress rapidly to death. Treatment is to terminate anesthesia, turn the gas off, flush them out, give them 100% oxygen, and administer dantrolene. Really good trivial question. What is the specific drug used to treat malignant hyperthermia? You got to know it for pigs and you got to know it for people. Dantrolene. And general principles for extubation and recovery are the same as for small animals, okay? And you want to leave an IV catheter in place if the pig is to be hospitalized for fluids or administration of intravenous medications. Key points for ruminants, camelids, and pigs. The main anesthetic concerns in ruminants arise from their unique digestive anatomy and physiology. Ruminants are susceptible to bloat, regurgitation, and hypoventilation under general anesthesia. Ruminants are generally very easily to handle, and surgery, particularly flank laparotomies, is often accomplished using a local anesthesia with or without sedation, most commonly without. Intubation is performed under direct visualization with a laryngoscope in small animals and calves, small ruminants and calves, often with the use of a stylet. And I think stylets usually work really, really good in these guys. Intubation of adult cattle is performed manually using a blind technique, that is your non-dominant hand, that involves direct palpation of the larynx. Ruminants should be placed in sternal recumbent during anesthetic recovery to allow for eructation. Keep the head lower than the rest of the body. The endotracheal tube should be left in place with the cuff partially inflated to minimize the risk of aspiring rumen contents or copious amounts of saliva. Anesthesia of camelids is generally similar to anesthesia of small ruminants. Camelids have very tight-fitting neck skin, and hematomas of the jugular vein or carotid artery may be partially obstructive of the trachea. Okay, we really don't want to cut off their air. Camelids are prone to developing nasal congestion under general anesthesia and should be recovered in sternal recumbency with the head and neck held up in a normal, neutral position to allow venous drainage to occur so they can breathe good. Preoperative physical examination of swine is limited to observation. There goes the pig. The main anesthetic concerns in swine are an inability to perform blood work, resistance to sedation, the paucity of peripheral veins and arteries, and the difficulty of intubation. You just don't have a lot of work with, okay? Scarcity of peripheral veins and arteries. Pigs are resistant to sedation compared to other species. They kind of drink drugs, okay? They are really heavyweights. The combination of tilazol, ketamine, and xylazine, TKX, is commonly used to provide heavy sedation or total injectable anesthesia in pigs. Yes, I've used it. Yes, I like it. It's probably, in my opinion, the best combination. After sedation or induction, the ear vein is usually accessible for catheterization. Pigs, you're probably not, unless you got a really, really sick or injured pig, they're not going to let you catheterize that vein. They just don't like that stuff. Intubation of swine is challenging because of poor visualization of the larynx, the unique anatomy of the oral cavity and upper airway, and the potential for laryngospasm. There are few palpable arteries in pigs, making monitoring difficult. Accelerometric blood pressure cuffs may not work well on the cone-shaped lens of pigs. I like my capnographs if they are intubated. Otherwise, a pulse oximeter works really good on these guys. And that kind of wraps up bovine, ruminant, camelid, pig anesthesia. And if everything goes well and you treat your cows good, you can ride off into the sunset. This looks like fun to me, so I'm going to end this on wishing I was on horseback moving some cows on a day like that in a place like that. That's it.